Welcome. Today's lesson is Can Dementia Be Cured? I'm Diane Carvo, RN. Dementia is a progressive and degenerative condition that affects over 55 million people around the world. With the aging population, the cure to dementia continues to be elusive, as 1 million new cases will be diagnosed a year in the U.S. alone. There are many different types of dementia. The common dementia symptoms are caused by progressive damage to brain cells that affect memory, communication, personality, mood, self-control, and more. In recent years, improvements have been made in dementia treatment. While there is no cure on the horizon, treatments for dementia can slow down the progression of cognitive decline, and that can temporarily manage symptoms in people with dementia. I do want to make you aware that there are many different types of dementias. Depending on the type of the dementia, it's sometimes possible to slow the disease process. There are some conditions that will have dementia symptoms, such as memory problems and decreased thinking ability. I'm going to talk about the reversible dementias. With early diagnosis and proper treatment, you can reverse the symptoms of dementia. This is not a cure for dementia. It is a cure for the dementia-like symptoms. Let me explain. There are medical conditions such as urinary tract infection or other infection in the body, such as pneumonia, which can cause a person to exhibit behaviors such as impaired thinking skills that are resolved when treatment is started. There are medications that may cause symptoms of dementia, and when the medication is stopped, the symptoms are resolved and memory loss and challenging behaviors disappear. Perfect example of that is a urinary tract infection. A person with a urinary tract infection, especially in the elderly, have no signs and symptoms except they will have a change in their mental status. And when you introduce antibiotics, it resolves and it doesn't come back when they're done with their course of treatment. How can dementia be treated? As I said before, dementia is a degenerative disease of the brain. There is no present cure. However, dementia research has expanded our understanding of this debilitating condition in recent years. Dementia researchers have helped to differentiate different types of other dementias. Since the different types of dementias have different causes, how to treat dementia are still developing. A dementia diagnosis might be directed to a specific type, rather than a one-size-fits-all style treatment. Effective treatments will be specific to the type of dementia. For example, some potential treatments for dementia. When immunotherapy is used to treat cancer, it targets cancer cells. That therapy destroys the cancer cells or stops them from reproducing. Dementia research is being conducted to see whether immunotherapy could be used in a similar way to target the different proteins that build up in the brain and cause destruction of brain cells in people with dementia. Other possible therapies are also being explored to treat dementia, and they include stem cell therapy that could support rebuilding of damaged brain cells, or gene-based therapies that are being explored. This therapy would target the genetic causes of dementia. Another approach of gene-based therapies that is being explored is a way to reduce the number of potentially damaging proteins produced in the brain of a person with dementia. Of course, none of these therapies or treatments are currently available. It's too early to say whether any of them will be a cure dementia. At the present time, there are medications that can help reduce dementia symptoms. Some medications may slow down the progression of dementia and improve the quality of life in people with dementia. Presently, the treatment approach is to address symptoms that a person with dementia exhibits. For example, in the middle and early stages of dementia, sleep disorders occur, and the introductions of sedatives may be introduced, or appetite stimulants may be given when a patient loses their appetite. In the future, treatments for dementia might be able to stop disease progression after dementia starts and has been diagnosed, or even cure dementia. Let's talk about current potential treatments for dementia. Anti-amyloid treatment is the latest breakthrough in Alzheimer's treatment. Anti-amyloid drugs target the root cause rather than just the symptoms. These innovative medications are given intravenously. They focus on clearing brain-clogging protein fragments. And this is a game changer in the treatment for Alzheimer's therapy. These new treatments are not without controversy, as it has been found that they may cause swelling of the brain. At the present time, these medications are not available. But despite the controversy, dementia researchers are optimistic and eager to uncover the full potential of anti-amyloids. This will bring hope to individuals affected by this devastating disease. Acetylcholinesterase inhibitors. These medications include Aricept, Exelon, and Reminol. These are also used in the treatment of Alzheimer's dementia. They improve communication between the nerve cells in the brain. Memantine, also known as Namenda, blocks a chemical in the brain that worsens dementia. This medication is prescribed for people with moderate to severe Alzheimer's dementia. As I said in the beginning of this lesson, there are many different types and causes of dementia. So let me address the different types of dementia. Vascular dementia is one of the most preventable types of dementia, and I'll address this ways you can reduce your risk for developing vascular dementia later in this lesson. Frontotemporal dementia is the type of dementia we're all hearing that Bruce Willis has been recently diagnosed with. In frontotemporal dementia, the frontal and temporal lobes of the brain shrink. It is a type of dementia that occurs between the ages of 40 and 65 years of age. Although there are some that will be diagnosed later, a frontotemporal dementia diagnosis is often initially diagnosed as a psychiatric disorder. This is because the areas of the brain that affects the areas that are responsible for emotions, behaviors, and communication. Frontotemporal dementia has no known risk factors except a history of dementia in the family. However, as in Bruce Willis's case, there are many that have no history of dementia at all in their family history. Now let's talk about Lewy body dementia. This is the second most common type of dementia after Alzheimer's disease. It is also another type of dementia that is often misdiagnosed. Factors that increase the development of Lewy body is age. You may be at greater risk after the age of 60 years old. Men are more disposed to developing Lewy body dementia than women. And those who have a family member with Lewy body or Parkinson's disease are also at greater risk. How to slow the progression of dementia. Dementia research has shown you might be able to slow the progression of the disease down. Of course, therapies and treatments can help. Lifestyle choices are really important, such as eating a heart-healthy diet. The foods you are for your heart also affect the health of your brain. Following a balanced diet lowers your risk of complications from other conditions, such as diabetes and heart disease. And just FYI, diabetes is thought to be the cause of dementia. The risk of dementia increases with those with diabetes. So you should develop an exercise routine as part of a way to slow the progression of dementia. Just like eating a heart-healthy diet, staying active is good for your heart and your brain. Exercise increases the blood and oxygen in your brain, and that can help maintain better brain connections. Getting 8 hours of sleep a night is really important because getting adequate sleep is healthy in many ways. The body heals when you sleep. And sleep allows your brain to rest and reset, and this can lower your dementia risk. Maintaining social connections. Dementia researcher shows that being social and getting involved in your community can help slow down memory decline. Keeping your brain busy. Try something new and different every day is a good lifestyle choice. This could be something as simple as using a non dominant hand for a task, or taking a different route home are just simple things you can do. Mentally stimulating activities, such as playing different types of games, not just brain games, creates new connections in the brain. Reading, learning new skills are also good for brain health. So, can you prevent dementia? At the present time, there is no way to prevent dementia from developing, but you can lower your risk of developing dementia and your risk of dementia. There will be some risk factors you can't change, such as family history or your genetics, but there are some risk factors you can manage. Addressing these risk factors could lower your risk of dementia. To prevent dementia, the lifestyle choices you make can impact you. Stay physically active or start an exercise program. Stop smoking or avoid smoking. Maintain a moderate weight. Eat a heart-healthy diet. Address your mental health issues, especially depression, because this is often a very early symptom of dementia. Drink alcohol in moderation if you drink at all. As I said before, try something new and different. Play unfamiliar games. Take different routes home. Learn a new language. Take up a hobby. Despite no definitive cure being available for dementia, treatments exist that can help slow down the progression of brain degeneration. Scientists are continually researching new therapies to treat or even potentially prevent this condition in the future. For now, people with dementia should stay active and socially connected, both strategies which can help reduce cognitive decline associated with their illness. So let's identify who's at risk for developing dementia. Unraveling the enigma of dementia, scientists have uncovered a mix of risk factors that can influence the odds of developing Alzheimer's and other dementias. Age is a risk factor. There is an increased risk of developing Alzheimer's disease, vascular dementia, and Lewy body dementia, and it goes up significantly with advancing age. Genetics and family history play an important role in the development of several types of dementia. Dementia research has discovered a number of genes that increase the risk of developing Alzheimer's disease. People with family members with Alzheimer's disease are generally considered to be at higher risk of developing the disease themselves. It's important to know that many people who have relatives with Alzheimer's disease never develop the disease. And many people without a family history of Alzheimer's disease do develop the disease. Unlocking the mysteries of dementia risk is a complex puzzle, with family history just being one piece. With certain conditions like Creutzfeldt-Jakob disease and fatal familial insomnia, they have genetic connections, but they can also strike without any known gene mutations. In these cases, individuals with mutations are on a high alert for developing such forms of dementia. Huntington disease and FTDP-17 are other examples where genes play a significant role in heightening the risk of dementia. Surprisingly, individuals with Down syndrome are also prone to showing Alzheimer's-like symptoms as they reach middle age. So while genes have a hand in shaping the risk, the entire story is yet to be unraveled. Did you know that lighting up a cigarette or drowning your sorrows in alcohol might affect your brain health? Research reveals a direct connection between smoking and heightened risk of mental decline, dementia, and vascular diseases. Put simply, the more you smoke, the likelier you are to face cognitive troubles later on. Similarly, alcohol can be a double-edged sword. Studies show that drinking heavily can push you towards the risk of dementia. However, you might be surprised to learn that moderate drinkers may have a lower risk of dementia than both heavy drinkers and total abstainers. So when it comes to alcohol, it's about striking the right balance to maintain your cognitive well-being. Atherosclerosis is a dangerous condition which can lead to vascular dementia or Alzheimer's disease. It occurs when plaque, which are deposits of fatty substances like cholesterol and other matter, accumulate in the inner lining of the artery. High levels of low-density lipoprotein, LDL, also known as bad cholesterol, increases risk factors for both conditions due to impaired blood flow to the brain, causing stroke-like symptoms, and these affect cognitive function adversely over time. Therefore, it is important to keep your LDL within healthy limits through diet and exercise throughout your life. And did you know that diabetes doesn't just wreak havoc on your blood sugar levels? It's also a sneaky villain behind Alzheimer's disease and vascular dementia. With its accomplices, atherosclerosis and stroke, diabetes conspires to harm your brain and memory. So stay on top of your blood sugars and stay vigilant and informed about your health. The cure for dementia is not in the near future. It is important to raise awareness of the risk factors and learn how to incorporate healthy lifestyle choices to decrease your risk for developing dementia. This has been brought to you by Caregiver Relief. I'm Diane Carbo.
Thank you for watching. Don't forget to hit that subscribe button and ring the notification bell so you never miss an episode of Caregiver Relief. If you have any thoughts, ideas, or suggestions for future videos, topics you'd like us to cover, or even improvements you'd like to see on the channel, drop them in the comments below.